like I said, I'm the health agent for the town of Dracut, and life wasn't bad. Then all of a sudden, February hit, and things changed quite a bit. So with the COVID, one of the biggest parts is the tracking and tracing. And right off the bat, when we first started this, the numbers started going up drastically in February and March. We're all learning on about this virus. We're all learning about the spread of it, all trying to figure out how it's going through. So one of the things is I had taken, I asked the engineering department to get me like a huge map of Dracut, and I pinned it to my wall. And then as cases come in, I just started putting little pin dots in it. And right away, within the first week, 2 weeks, all of a sudden you started seeing a trend. Certain areas and were a lot more. The virus was hitting that a lot more than a lot of the other areas. So started just trying to figure out why, and a lot of them were very dense areas that were that the houses were a lot closer. There weren't big yards. They were more of like the camp areas, the old camp areas and stuff. And so the thing that was happening is those areas, if you go by, are very social people because it's almost like campgrounds. You're all next to each other. You go out at night. Hi, Bob. Hi, Harry. Have a couple of beers together, whatever. And so I noticed that area. So we went up and talked with them, let them know that the numbers were going high, specifically just in that area. And I was very interested to see. And then once we talked and we asked for some social distancing over the next month or so, that area adjusted to mostly like the rest of it. Another thing over time that I noticed is in Dracut, there's a lot of great, nice people that work in the health field. So for quite a while, we've seen that it was the nurses, the people, the first responders. So the people who do home care that go house to house if you need rehab, or the ones that go if you need somebody to help clean a couple of days a week, or the people who travel house to house, the nurses from the different health establishments around, because there's a lot of them in the area. So we started noticing that the next little trend was the people in the healthcare and their families. Because a lot of times when somebody gets it and then they were at home, the rest of the family kind of gets it too. So that was skewing the numbers, and not much we could do about that because they're great people who put themselves at risk every day, and a lot of them were catching it. The main thing we do too is in the office is, so the way that it works is that if you go get a COVID test and you become positive, it goes right onto a site that's called Maven. And Maven is a countrywide. So if you live in Dracut and you were on vacation visiting your relatives out in Nebraska or Wyoming, wherever you were, and you became positive, that goes right to my desk. So I'm responsible for that case no matter where you are in the country. When it first started, I had 2 people on that cruise ship that was stuck out there for a bit, and they ended up in Georgia. So I was dealing with them in Georgia and going over the tracking and tracing with them. So the whole country goes by zip code. So that way it makes sense for people to be able to document what they have. And so when they say the numbers, most of the time the numbers are actually true because it goes right to that exact zip code of where it is. So that's the same thing. So one of the problems they have is when they're doing the test, you have a mask on like this, if you have where you can hear me, and so does the other one. So you're trying to give your phone number, your address, and all the other stuff. So we come over to our thing. So we open up the Maven case. So the next Maven case, I see Ken Barad, hopefully not, but it goes Ken. And so then when I look at it, it gives the place you had your test, and it also gives your address and your telephone number. So I have nurses back at the office, and they call up and talk to you because they got to find out more about you. We got to find out how many people are in your family. Where do you work? Were you on vacation? What was, try to figure out where you might have gotten it. And then from there, we got to build that Christmas tree of, starting with you. How many family members? Where do they work? Where do you work? And then from there, we got to call your boss, depending if you were at work the last 2 days, if you were at a wedding, if you were at a family event, if you were at something. So we got to start contacting as many people as we go. But everything is because of the HEPA laws. We can't even say it's you. We have to just say over the last few days, you might have been in contact with somebody who was positive. You're a direct contact with them. You've spent, because the person will tell us how many hours or if they've been with them. but at the same time, we can't say who it is, which makes it very hard, which just makes it crazy because the people get all upset and, you know, you're telling me this and you can't tell me who I was with and all that other stuff. And sometimes, you know, it's somebody they're with all the time. And the other thing we get sometimes is when we call, the person says, "Who are you calling my house? This is supposed to be private." And, you know, and they get mad. So just pass the word, never get mad. It's the contact tracer's job to just follow up. And we're always here to help, because if you need something, we can help you with it. If you're nervous, we can explain stuff. And that's probably barely 1% of the people act like that. And then once we do get in there a little deeper, sometimes they understand it better and become a lot more compliant in helping, because the only way we can do our job is how well that they give us information of who we can contact next. So the other problem we have too is, like I said, with the mask on like this, and they have just taken your test, and so they said, "Well, what's your phone number?" And that's our main way of contacting. And then the phone number could be off by a digit. The phone number could be wrong in many different ways. So at that point, in Dracut, that's when my nurses give me the addresses, and I go right to the people's houses, which is not a common price practice at all. So when I first started, I had a big piece of cardboard, and I'd go to your house, because we have a lot of single family homes out there. I would knock on the door, ring the doorbell, and then I would just hold up the sign, "Hi, my name is Dave Ouellette, health agent for the town of Dracut. Please call this number." And then once they gave me the nod or the okay from it, I would get in my car, because I didn't want to be up close and personal, because it's the time to definitely social distance. I know this person is positive. So then I would just go into my car and we'd talk, and we'd have the conversation there. I'd give them the information to call our nurse. I'd let our nurse know that Ken was going to give a call. I did contact him. I found where the mistake was in the phone number. So that one actually made a Dracut magazine. I was writing a story because the lady that's running Lowell, what's her name? Roe, WROE. She was tracking and tracing for Africa. She's been doing it for years, one of the top at her field. And she's actually the person that is running Massachusetts. And so on it, I guess somehow or other the story got out that there's this crazy person in Dracut actually going to people's houses holding up signs. And so I got a call from the Dracut magazine, the Dracut Review or whatever, asking if that'd be true. And I go, "Yeah, that is true." And so we've captured a lot of information by actually doing that. I've used that many, many, many times, and which has worked out well. The other thing too is like on addresses. So let's say you live in a garden style where there's 24 apartments in it. They might say 85 Cabot Street. Well, 85 you get there, and 85 Cabot Street is an apartment complex. So then I have to decipher and find out which unit is this in, but I can't really ask anybody because I have my name on my shirt. I have all this other stuff. So I got to do it all without asking anybody any question. And sometimes I have to wait for somebody to go in so I can get into the next part of the hallway so I can see the mailboxes with all the names on it, or different things like that. And again, 85 to 90% of the time I can track you right down, and then we can get the nurses and we can help you, which keeps the numbers low. So right now in Dracut, we're doing very, very well. We do have a slight uptick. We only have 24 cases as of last Friday in a town that has like 34,000 people. And that's the highest it's been in the longest time. We were keeping very low. Again, it's hard to say because I'm bound by HIPAA, so there's a lot of stuff I can't say because things sometimes aren't as bad as they seem. So sometimes your numbers could go up for a few different reasons. Right now, the governor is telling in the colleges is telling every college kid you must get tested. So with more testing, of course, your numbers go up. So it doesn't mean like somebody was just out partying, or this one came from here, or this one come from there. There's a lot of people that go around asymptomatic. They might have it. They'll have it for the 2 weeks. It'll go through their body. But right now, if you're doing thousands of tests, you're going to catch many, many, many people and so that makes your numbers go up. The other thing too is that sometimes where somebody does get it, you could have a higher number because one person might have it, but they might have a large family at home of 4 or 5. And so then once it starts going through the house, you could have one house with 4 or 5 people. And so if you do that twice, all of a sudden you have this high number 1 week, and it went up like 8 or 10, but it's could only be 2 houses. And that happens also. So there's all different things, and my cat just keeps trying to get on my lap. Oreo, stop it. Track and tracing anywhere in the country. businesses.
Hey, Dave, can I ask you a question?
Sure.
Yeah. So in terms of what your job was before COVID versus what it is now, what has changed?
Oh, just time to be able to do something. So, as a health agent, my job is also let me let you know what we do, and in that way you can see how much it's changed. So we have 120 food type places in Dracut, that whether that be gas stations, restaurants, and anywhere in between, full blown restaurants like Lindsay's and that type of thing, and even to the mom and pop, just one breakfast place, and Wendy's, McDonald's, and that stuff. So according to the thing, I have to inspect every one of those twice a year, completely. So that's 240 inspections right there. If anybody failed it, I have to go back. So that can be 260, 270 inspections just to take care of those. Plus any issues that you have in town, whether it be trash on the sidewalk, or you're calling there's mice in your house or something and the landlord's not fixing it. Also got to do that. The cat one. Oh, and he was outside in the rain. Oh God. So let's see, where was I? And then also if there's okay, go. The let's translate. Oh yeah, so we have many things. Whether it's we also do all the septic systems in town. If somebody has putting in a new leach field, they got to inspect the bottom of it, all of that. So it's pretty busy plate, which is very doable for one person, because I'm in Dracut. There's only the health agent. I do have a secretary at the office, and there's also one nurse, which we hired another nurse for my office. And when this reached maximum thing at one time in Dracut, when this started, we were running about 185 cases constantly. People were getting it, people were curing. So every week we had 185 files of different names that we were tracking and tracing, which was very time consuming to say the least. And we're trying to calm, because this is February, March. Everybody's first getting it. Everybody's still trying. Everybody's nervous as could be when we call. So the phone conversations were even longer, and what was going on. So that really changed the dynamic of what goes on in the health department, and like, let's say Dracut. So and nothing else goes away. People are still building houses, putting in leach fields. The restaurants still need to, because I got to make sure it's food safety is a priority. So if you go out to eat, you don't want to get sick from anything that way too. And I got to say, the places in Dracut are absolutely terrific. And then I also got to deal with all the people with trying to go in. So like with COVID, if you're going into a convenience store, if you're going into this, they have that thing that if you say you can't wear a mask because it might be a difficulty or this or that, that you have a right not to walk, not to wear one. But I'm very adamant against that as much as possible. Because if you're wearing a mask, you're an elderly person, you have children, you might be pregnant, you might be this. You don't want somebody just being next to you, breathing on you without a mask just because they're saying that they can't. Most of the time, if pressured, they'll go out in the car and they'll get a mask and they'll put it on. We've had cases where people are very adamant and they've yelled at hostesses at restaurants and everything. So if you're sitting down, eating with your family, eating with your wife, you don't want somebody walking, because you're at a lower level now. You're sitting down, and as they're walking in, they're breathing down on you. And then and God forbid they cough just as they're going by. So the ruling says, as long as we give you reasonable accommodations. So whenever anybody does that, I told all the stores, as much as possible, just don't let them in. Say, if you want something at the convenience store, what do you want? A pack of cigarettes, a Coke? You stay on the sidewalk. You do not come in my store, because it's not fair to the other 15 people that might be in there. And if you cough in your hand, or if you do something, or whatever you're doing, you're going to spread stuff in here. So to keep the spread down, you don't want to wear it, because a lot of times, like especially going to your seat in a restaurant, it's going to be 12 steps, 14 steps, 20 steps at the thing. You can can put something on to walk those 15, 20 steps.